Joining us now, clinical assistant professor at the NYU Grossman School of Medicine's Department of Population Health, Dr. Lippy Roy. She's an NBC News medical contributor. Dr. Roy, good to see you as always. Let's begin with where we are in this coronavirus crisis. We've seen huge spikes in states that you're well aware of. We've been talking to physicians inside emergency rooms from Arizona to Houston to South Florida who say they are now overwhelmed in those ERs and those ICUs. We're approaching 60,000 cases a day, setting a new record again yesterday. What are your concerns now as we push on through this summer?
Yeah, good morning, Willie. I mean, when I look at that map, it's ironic that the name of this country is the United States of America. What I see is 50 disjointed states of America. Each state has been left on its own, left to its own devices, struggling to respond in whatever way they can to keep their residents safe. That's not how this should be working out at all. You know, in your previous segment, when you're talking about the CDC and these careered scientists and professionals, public health professionals, they're handcuffed. They're giving recommendations, but they're being persuaded under political pressure to soften their guidelines. Their primary mission is to maintain the health and safety of the American people, and that's just not happening. And when you look at what's happening in states such as Florida, Texas, California, it's alarming from a medical standpoint, Willie.
So, Dr. Roy, we know at least in the state of Texas, they have rolled back some of their reopening as the cases have exploded there. Florida has done some of that, but not as much, and still talking about opening schools. As a public health expert, what would you like to see in the states of, let's say, Arizona, Texas, and Florida right now to stem this?
Willie, I'd like to see the local leaders, from the mayors to the governors, really follow evidence-based guidelines. The only two measures that we have right now for this virus, for which we have no cure, no treatment, no vaccine, the only two public health measures that we have are prevention. It's covering your face, and I do not leave my apartment without wearing a mask. So covering your mouth and your nose, and the physical distancing. As you know, Willie, here in the Northeast, when we experienced a hellish period, we shut down. Governor Cuomo made the tough decision to shut down businesses, tell people to stay at home. Elected officials need to be held accountable, Willie. As a physician, if I behave this way, said, oh, masks optional, we won't be practicing social distancing like the South Dakota governor recently said, I would not only would I lose my job, I'd lose my medical license. Elected officials need to be held accountable and need to be held to the same standards, Willie.
Yeah, those things should not be political. Dr. John Meacham has a question for you. John?
Doctor, as you look at these numbers, and is there any way out of medically, public health speaking, returning to where we were in the middle of March? Where I live in Tennessee, we have different phases. There's argument I think we're in phase 3, but most folks who study it say we should be back in phase 1. That in fact we were impatient. We as a country, we were impatient. We did not trust the expertise. And like the president, too many Americans got bored with the crisis, wanted to change the channel, but the virus doesn't care about that.
Yeah, John, thanks for framing it like that. And that's exactly what you're seeing in the country. You're hearing expressions like COVID fatigue or pandemic fatigue. The problem is that this virus doesn't give a damn about your fatigue or my fatigue. It's going to keep on infecting people who create an environment for it to thrive, right? So this virus, this highly infectious pathogen, loves when people congregate. When we're close to one another, the respiratory droplets can transfer. And yeah, I get it. Look, John, I get frustrated too. I want to go out and have a good time and go to hockey games and all those things. I cannot do that. There's a widespread community spread of this virus, as you can clearly see by the different states. And you're right. You're in Tennessee, so there are certain parts of the country that just didn't have many cases. And so when New York again was going through New York, New Jersey, going through this hellish period in March, April, many other parts of the country are like, oh, it's not really affecting us. This is a Northeast problem. Actually, it's not. And we can see this as plain as day. This virus is affecting everybody in every state.
Dr. Roy, as we move across the Southeastern Conference, we go from Tennessee to Alabama. Joyce Vance has a question for you. Joyce.
Good morning, Doctor. I have a question looking a little bit forward. I know we're all focused on today and trends in the virus, but looking ahead to November, many states have adopted new provisions for voting. They're expanding mail-in voting. But in other states like Alabama, voting is predominantly in person. And we know that historically many voters, particularly elderly voters, are much more comfortable voting in person. So looking from a public health, a medical perspective, do states need to be taking steps now to ensure people can vote safely in November, or do you think this crisis will be over by then?
Joyce, I'm not seeing any evidence that this pandemic is going anywhere anytime soon, certainly not by the fact that the way we're reacting to it. And the way this pandemic, the direction it'll go will in many ways be dictated by our own behaviors. So until we really kind of stay at home, practice physical distancing and cover our faces with masks, this is not going to get better. And to your point about older individuals who go in person and many other states in the South, like in Alabama, we also have a high proportion of African American individuals. These are populations, older, chronically ill, Black Americans. These are individuals who are disproportionately impacted by this virus and by this infection. So we need to think very carefully about creating options so that these individuals can vote safely from home and not get infected by this virus, which unfortunately, I don't think is going anywhere. And remember, we have the influenza season starting in September as well.
All right, Dr. Lippy Roy, NYU Grossman School of Medicine. Always appreciate your expertise. Thanks for being here. Coming up on Morning Joe, Joe Biden pushes his pitch to boost the country's economy, how he plans to bring back, he says, the millions of jobs that have evaporated during this pandemic. Morning Joe's back in a moment.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.